Okay, thank you. Good evening, everyone, and I hope you all are doing well. And thank you, everyone, for coming and attending this evening session. So, today's topic is all about understanding the behavioral and the cognitive approaches in the pediatric population. This is also one kind of a part of a therapy what we use in treating the peds population, also in adult population, but specifically we include more this in peds population. So, things we're going to learn today is about behavioral therapy techniques, cognitive behavioral techniques, autism spectrum disorder, ADHD, and the doubt session. So, does anyone uses this therapy technique in your clinic or your hospitals or in your setup? And if you're using, what are the different therapies what you use? What do you mean by the behavioral therapy? Like, this is just a general question. Anyone can answer. Do you use this therapy, or what kind of therapy you use in the behavioral therapy techniques in your peds population? Okay, I got one answer. Modification of the behavior with the use of reinforcement. Superb, Dr. Shweta. Amazing. Anyone else? Okay. So, what is behavioral therapy? Behavioral therapy technique or the behavioral therapy is a term that describes a broad range of techniques used to change the maladaptive behaviors. The goal is to reinforce the desirable behaviors and eliminate the unwanted ones. Rooted in the principle of the behaviorism, a school of thought which focused on the idea that we learn from our environment, this approach emerged during the early part of the 20th century. It became a dominant force in the field for many years. Edward Thorndike was the first to refer the idea of modifying the behavior. Behavioral therapy is action based. So basically, the behavioral therapy talks about that we modify the behaviors from the environment. It is always action based. So whatever you see in the environment, you always react to that through the actions. And the behaviors which are good enough for your growth and development should be um, taken inside the body. And the behaviors which are bad for your development, which are hindering your development, cognitive development, mental development, or development, has to be eliminated. Everyone clear? Any difficulties? Up. So there are, just a minute. Yeah. So there are different behavioral therapy techniques. What we are going to discuss today is the first is applied behavioral analysis. This type of the therapy uses an operant conditioning to shape and modify the problematic behaviors. Okay, so basically, in this therapy technique, we specifically understand what is the problem, how do we modify that problem, and how do we condition the problem. The problem could be anything. It could be throwing tantrums. I'm taking an example of the child or the pediatric population here, throwing tantrums or crying just by looking something or having some unwanted behaviors while doing the treatment or going to the school. So you have to understand what is the problem behind that behavior, then condition that particular behavior and make sure that you eliminate the problems in that behavior. Second is a cognitive behavioral therapy. This is the most common technique what we use in behavioral therapy. It relies on the behavioral techniques, but there is a difference in the cognitive behavioral therapy because it adds more cognitive element to solve the problems. Okay, in this basically what are we doing, so you have to use more cognitive power or the mental power. You have to give that task to the child so that they start thinking which is right, which is wrong, and then change their behavior. Third is a cognitive behavioral play therapy. It utilizes a play to assess, prevent, and treat the psychosocial challenges the therapist may use to help a child learn how to think and behave differently. So, in this therapy, the only thing what you add is the play based exercises. So, there are play therapy, there are play groups where you give them some kind of play activity. That play activity has to be included with more mental exercise. And once this mental exercise and play based actions are done, they have a change in behavior. Because, as I mentioned, that the behavioral therapy uses more environmental support. So, when you create a play based environment there, that play based environment will give them reaction. Once a reaction action is given, they'll start thinking mentally or cognitively what has to be done, and the action and the good behavior is happening. Everyone clear till now? Any difficulty? Okay. The dialectical behavioral therapy is a form of the CBT that uses both behavioral and cognitive techniques to help the people learn to manage their emotions, cope up with the distress, improve the interpersonal relationships. In this, basically, we use um, the behavior. So basically, there are two, there's one therapist and one child. They know each other's behavior. With understanding what kind of behavior they like, you have to create a cognitive and a play place exercises to manage the emotions and increase the relationship between the two individuals. Next is the exposure therapy. Exposure therapy basically utilizes the behavioral techniques to help people overcome their fears of situation or the object. This approach incorporates techniques that expose the people to source their fears while practicing relaxation strategies. This can be used usually for phobias and any other form of anxiety. Specifically, this exposure therapy works very well for children who have autism or ADHD, who has a lot of phobia, or some children who have a lot of anxiety. Okay, in such pediatric population, you use this exposure therapy. So basically, what does it works that you have to fight against your phobias. So you can create a visual picture. Suppose they tell that they are very frightened to go in the lift. Okay, so create an environment, create a play based therapy that you are imagining themselves to go inside the lift so that they don't start feeling claustrophobic. Then slowly take a confined space, then slowly you can make the child go inside the lift. So this is called as exposure therapy. So slow exposure and a proper way exposure will help them to fight their fears and treat their phobias. Next is the rational emotive behavioral therapy, which focuses on identifying the negative or the destructive thoughts and the feelings. People then actively challenge those thoughts and replace them with more rational and realistic ones. Okay, so in this, what do you mean by that? So, some children have a few particular mindset. So when I was a child, I had a mindset that I don't want to go to a dentist because dentist creates a lot of pain in my teeth. So that was a negative thought and the feeling. Okay, so that was it was shut in my mind that whenever I had a teeth pain, I usually used to cry a lot, but I will never go to the dentist because I was very feared with them. So some children have a white coat fear, right? So that is an emotion. So basically, what you have to do, you have to challenge those emotions and make it more realistic. So how will you do that? You can start giving a dental hygiene talk on that. You have to make sure that you put inside the brain of the child that how dentists or the doctors are important. I'm just giving a layman example. You can use this example in your treatment techniques also. Make it more realistic, make it more rational for the child to understand that this is good and this is bad. Once you make sure that this is happening, then you can make the child go to the dentist easily so that they comply. So this you can do the same thing for the treatment approaches. Next is a social learning theory. It centers how people learn through observation. Observing others being rewarded or punished for their actions can lead to change of learning behaviors. So this is a classic example of any murderer who is put it in the jail. Imagine a person has done a murder and they're putting themselves in the jail. So in the jail, what they do, they make sure that the person starts changing, they do good deeds, they see each other, they realize what they have done wrong and they come out of it. Same thing in children's. What you can do is you can create one group therapy session for such children's where there are same alike children's there. If you feel that one child is doing a bad behavior, you can give a punishment so the other child understand that this has to be not done, and according to that, the behavior changes can happen. Everyone clear till now? Any difficulties? You can use many therapies in one session also. You can mix and match all the therapies according to what your child likes, according to what your child is suitable for, what is the therapy suitable for, then only you can go ahead. Now, can it will be helped via the behavioral therapy. So basically, in behavioral therapy, which kind of patients can be helpful? So one is a bipolar disorder, as I already mentioned, who has a lot of maniac episodes and the depressive episodes, alcohol, substance abuse disorders. There are many children nowadays you see on the roads who are undergoing rehabilitative processes because people have, drugged them and dosed them, and at early ages they start having alcohols, anxiety, ADHD, autisms, borderline personality disorders, depression, eating disorder, panic disorder, phobias, or obsessive compulsive disorders. So these are all the techniques or of the behavioral play therapy which can be used in such pediatric population to see a good cognitive and the behavioral changes. So there are two type of conditioning what we need to understand in behavioral therapy. One is classical conditioning, one is operant conditioning. Now, what is classical conditioning? It involves forming association between the stimuli. Previously, the neutral stimuli are paired with the stimulus that naturally and automatically evokes a response. After repeated pairings, they form an association, and the previously neutral stimulus will come to evoke the response on its own. This is classical standard. I will come back to how I'll explain. Second is a operant conditioning. Operant conditioning focuses on how enforcement and punishments can be utilized to either increase or decrease the frequency of the behavior. Behaviors followed by the desirable consequences are more likely to occur again in the future, while those who followed by the negative consequences become less likely to occur. So, what is the difference between two? In classical conditioning, basically, as you know, conditioning means anything when you do repeatedly, that repeated behavior is fitted inside your body to understand that this is correct, and that is called as conditioning. So, in classical conditioning, basically, imagine I'll give you an example that the child is playing with the Lego. Okay. So basically, whenever the Lego is kept in front of them, the child will immediately take the Lego and start making the Lego pieces. It will start joining the Lego pieces. So that is a stimulus which is given. So that Lego is a stimulus. And the normal response, what a child will do, is naturally coming out of it. So once you give any other example, suppose that Lego is given, now you give any pencil stands or you give a stack of any other toys. So the same stimulus is used in the other activity. So that is called as classic conditioning. So if your body and the mind is ready for one kind of activity, and if you give the same activity in some other form, already the body knows what they have to do. So that is a classic conditioning. Now, what is an operant conditioning basically is it can be used with the help of punishments. Okay. So if the child is coming to your clinic and once they come they don't remove the shoes and they start running here and there, they start yelling. So the punishment what you need to give is that if you don't remove your shoes, you will have to do walking for 20 rounds. Okay, so that's a punishment. So that punishment is has to be also in a way that the child is getting benefited, so that will increase the better behavior and also make sure that the bad behavior or the negative behavior is not happening again and again. So that is an operant conditioning. So the child will get inside the mind that if I don't remove the shoes next time and I keep running and yelling inside the clinic, the physiotherapist will tell me to walk 20 rounds. So that negative consequences, that reinforcement and the punishment is set inside the brain of the child so that he will not do the same activity again. Everyone clear with two types of conditioning and how you use in the behavioral therapy? So today's lecture is all about understanding the different techniques. I'm giving different examples so that you can connect well and you can use in your clinical approaches. Now, what is cognitive behavioral technique? So in behavioral therapy, the most common and the most interesting and the most used technique is cognitive behavioral technique. So in cognitive behavioral technique, it is all about thoughts, emotion, behaviors, and physical actions or physical sensation. So CBT is a type of a psychotherapeutic treatment that helps people learn how to identify and change the disturbing thoughts or the destructive thought patterns and remove that negative influence from the behavior and the emotions. Cognitive behavioral therapy focuses on changing the automatic negative thoughts that can contribute to worsen the emotional difficulties, depression, and anxiety. These spontaneous negative thoughts also have the detrimental influence of the mood and the physical activity. Okay, so basically, the cognitive behavioral therapy in small terminology tells that you have to identify which is a bad behavior, you have to remove that negative behavior, and make sure that you have a good behavior which can improve your mood, improve your physical activity. That is what the cognitive behavioral therapy or technique works. So, first thing, whenever you are doing a cognitive behavioral therapy, you have to first identify the negative thoughts. So, what are the steps of cognitive behavioral therapy? So, whenever a child is coming to you and the mother is coming to you, they will give you the history, what the child likes, what child don't like, which behaviors have to be changed, which behavior is has a negative influence on their mood, their cognitive health, and their physical health. Once you understand these negative thoughts, it is important to learn the thoughts, feeling, and the situations which are contributing for the unharmful, harmful, or maladaptive behaviors. This process can be difficult because it takes a lot of introspection and a lot of time to understand the behavior of the person. But when it takes time, you have understood the proper um, thought about the person and which insights are essential for the child. Now start practicing the new skills. So once you are spending more time with the child, once you are knowing the behaviors, what they like, what they don't like, how will they react to any particular situation, once you understand that behavior, then you can start practicing the new skills. So you start removing the bad behaviors and start implementing the good skills. In cognitive behavioral therapy, people are often taught the new skills that can be used in the real world situations. For an example, someone with a substance disorder might practice new coping skill, rehearse the ways to avoid and deal with the social situations that could potentially trigger a relapse. Okay, so they have to keep practicing the new skill so that it is more effective at their cognitive level and making sure that their physical growth is also happening better. The next step is the goal setting. Once they have practiced a new skill, now you have to set the goals. Goal setting can be an important step in recovery from the mental illness, helping you to make the changes to improve the health and the life. During the cognitive behavioral therapy, the therapist can help you build and strengthen your goals with the help of the SMART goals. So, SMART goal have to be sustainable, measurable, it has to be adjustable, it has to be properly reliable, and it has to be very real life. Okay. So if any of these settings, what you're doing, it is very hypothetical, it will never work in the child. Next is problem solving. Once the goal setting is done, you have to give them real life problems. You have to give the problems in their way. They have to use their cognitive health, cognitive mind. They have to use their cognitive skills to solve the problem and come up. Once they solve the problem, they achieve it, they go to the final step of the success, and they have to do the maintenance. That maintenance is basically of self monitoring. If you make sure that the child is having a lot of tremors or have has a lot of fits when the child is not taking any substance or they have a substance disorder, once you give the problem, so basically you have to give them those substances and you have to see how the child is avoiding. If the child is successful in avoiding that substances, then you make sure that the child is going for the self monitoring. If you see that the child is melting away and start again having that abuses, it means the child is not ready for the real world. Understood? Any difficulties? Yes, no. So, which conditions can be helpful via the cognitive behavioral therapy? Addictions, anger issues, anxiety, bipolar disorder, depressions, eating disorder, panic attacks, personality disorders, and phobias. So, usually anything which is related to with more of emotions, thoughts, cognitive processes. These are the people, or these are the pediatric population which you usually help in cognitive behavioral therapy. CBT is also known for providing few key benefits. It helps you to develop the healthier thoughts to the pattern and becoming more aware about the negative thoughts, which dampens your mood and the feelings. It is effective for the short-term treatment as to improve. Improvements can be seen in 5 to 20 sessions. It is effective for the wide variety of maladaptive behaviors. It is often more affordable than the other types of therapy. It is effective whether the therapy can be online or face to face, and it can be used for those who don't require psychotropic medications. So, whatever conditions we have seen, if you feel that the child is able to understand your commands, is able to understand the logic behind it, and they don't need medication. This is the most cheapest and the most easiest technique what you can use. This is majorly used by the occupational therapist, psychologist, psychiatrist, and the physiotherapist, specifically who are dealing with such patients. Clear? Any difficulty? Yes, no? So now we are going to understand about ADSD. As in the first and the second lecture, everyone mostly mentioned. I think somebody has to be muted. Dr. Ram Prasad, please mute yourself. So, autism spectrum disorder. It's a disorder which I think majorly everyone is seeing in their clinical setups or the hospitals. It is a disorder spectrum. So spectrum basically means it is a very large umbrella. In that there are many different varieties of the autism, which has to be discussed, and any of the child will have any type of ADSD or ASD. ASD is basically a neurodevelopmental disorder. It can be happening in the infants or the early childhood. The major problem here is about the social interactions, communications, where they don't understand the emotions. They don't have that communication skill set which is developed. Their behaviors are more repetitive, it is very restrictive, and their activities and interests are more alone. They don't like to play with people. Okay. So, autism spectrum disorder is a condition where the brain development impacts how the person perceives and socializes with the other person. So, normally, if you take a child in a park and there are already 4 5 kids playing there, so they will go and they will play with the kids, which is a normal social interaction. As we know that the humans are a social animal. If you don't socially interact, humans can never grow. Whenever you were a child also, you have learned a lot of things with the help of your environment, with the help of the people around you, with the help of your family. If those people were not there, you would never be the person what you are today. So such children who have ASD, it is very difficult for them to interact with people, very difficult for them to perceive the emotions, perceive the stimulus which is coming from the environment, and making and they have a communication problem. This disorder also limits and has a repetitive pattern. And autism spectrum disorder begins in the early childhood, and this can cause a problem so that the child is not functionally available and cannot be socially working at the school or at the work. Some children with the autism spectrum disorder have difficulty in learning and will have a very less intelligence, and other children normally have the higher intelligence. So I think many, I don't know if you all have seen, so you might have seen a series named as The Good Doctor. So in The Good Doctor, the main doctor, okay, he had, I think his name was Dr. Sean. He had a higher IQ. Okay, when he has a higher IQ, he is also a autism spectrum disorder patient, but he has a higher IQ. So in such patients also, it is very difficult for them to make a eye contact, speak to people, but he had a good learning skill. When they have a good learning skill, but the communication is a gap, you can always start doing cognitive behavioral therapy in such patients. Some patients who have a very low IQ and also has ASD, in such patients you have to use more special therapies, because it is very difficult for them to learn things, and it's very difficult for them to communicate. So always start with the low based IQ exercises or activities so that it is easier for them to grasp. Everyone easy? Any difficulty till now? So what are the different signs of autism? So basically, the autism signs have to be are usually picked up by the family members or the caregivers. So first, they have a issue with the communication. They do not respond when the name is taken. Second is hysterics. Hysteric means random episodes of laughter. Without any reason, they will start laughing. Third is aversion of the touch. They will never like if the person is touching them or coming near to them. Then is they are very sensitive to loud noises. Tiptoeing, ignoring the danger. Say they don't have any communication, they don't have any feeling, so they will not understand what is danger and what is pain. Okay. Avoiding the eye contact. They will not see, they will not have an eye contact. They prefer playing alone at home. They don't like to go with the children's around, and they have a delayed speech. They will not able to speak well, because once they don't know the emotion, how will they express the emotions? So this barrier is what you have to break. So there is a barrier when in between the autism children and the world around, and that barrier has to be broken. Once this barrier is broken, then only the child can interact better. It takes a lot of time, lot of effort, and lot of people when you are dealing with an autism child. Everyone easy? Any difficulty? So when you have to see the doctor, so these are the few things what the mother and the caregiver or the family member should understand. When the child is not responding with a smile or the happy expression by the 6 months of the age, because with the 6 months they will start having a social smile. Second, doesn't mimic the sounds or the facial expression by the 9 months, doesn't babble or cue by the 12th month, don't have a gesture or the wave by 14 months, don't say a single word by 16 months, doesn't play or make believe or pretend by 18 months, don't uses two-word phrases by 24th month, and loss of language skill or social skill at any age. So these are the early signs where you understand that the child can have autism spectrum disorder. It can be detected at any age. It can start at 1 year, or it can also go up till 5 years. It is very difficult to pick up because some children usually have a delayed speaking. So I cannot claim that the child has autism. Okay. So make sure that everything is matching. Then only you have to see the doctor. Everyone clear with autism spectrum disorder? Any difficulties? Okay. Now we'll go to ADHD. ADHD is attention deficit hyperactivity disorder. In the name only, you understand that these children have attention problem, they have attention deficit, and they are very hyperactive. Okay. ADHD stands for attention deficit hyperactivity disorder. It's a brain disorder which affects how you pay attention, how you sit still, and to control your behaviors. It happens in children and the teens who can't continue into the child adulthood. The most common diagnosis could be a mental disorder in children, and it is usually spotted in the early childhood years of school, and where the child begins to have attention problem. Usually, when you put the child in the schools, nursery, KGs, whether the teacher will start understanding whether the child is attentive or not. Imagine the teacher is calling you that you pay attention and you're constantly doing something else. It means that they have less attention problem, and they are constantly moving around. They can't sit in one place for a very long time. So there are different types of ADHD. One is inattentive, which in this condition they are not attentive to any one thing at the one time. Second is hyperactive, they keep changing places from one place to the other. And the third type is mixture, where they are not attentive, they keep doing 10 things at the one time. They'll play with one toy, immediately they'll go to the other toy. They'll be hyperactive, they'll keep running, they will keep climbing here and there, keep yelling. So this is a combination of ADHD. So there are three types: inattentive, hyperactive, and combined. So symptoms of the ADHD is often begins late and forgetting things, restlessness because they don't sit in one place, trouble controlling the anger, impulsiveness, trouble staying organized, procrastination, easily frustrated, often bored, trouble concentrating while reading or writing, mood swings. Okay, so these are the few symptoms of the ADHD, which a teacher or a mother or a caregiver or the family member will start noticing. Once it is noticed, then you have to take the child to the neurologist. There are few tests which are also there in order to confirm whether the child has ADHD. One is a physical exam and the neurological assessment that includes screening of the vision, hearing, and the verbal motor skills, and evaluation of intelligence, aptitude, personality traits, or processing skills also can be done in such children. So, when you go to your neurologist, it's not only the neurologist, but it's a mixture of the neurologist, psychiatrist, and the psychologist all working together to take these tests. Once these tests are done, the psychologist will understand what is the major problem. And if these ADHDs are uncontrollable, you need to take the help of the medicines to reduce the restlessness. So, the major line of treatment in ADHD children is cognitive behavioral therapy, ADHD courses, coaching, Stimulants, your doctor may ask, like amphetamine or methylphenidate. These are the medicines which can stimulate the good side of the brain so that they are attentive. Non-stimulant means any children who is very hyperactive, you have to give the non-stimulant medications. Lifestyle changes, regular exercises to make them more focused and reduce their impulsiveness. And also you can increase more uh, repetitions of the activities, and make sure that the diet is good and making a friendly environment around them. Everyone clear? Any difficulty?